Our next speaker is Dr. Jill Melliker-Larson, and she's going to talk on Cosmetic Botulinum toxin, the basics of offering this in your practice.
Thank you, Wendy. Thank you, Rich and Jeremiah, for asking me to participate in this conference. We're going to talk a little bit about adding neurotoxin to your practice. I'm in a multi-specialty practice in Minneapolis, Minnesota, and have had to do this in the last 10 years, so it's near and dear to my heart. Here are my financial disclosures. Two journalists wrote in Newsweek in 1998, "We have seen the face of the future and it is wrinkle-free." And I think today's society, anti-aging techniques and discussions are in the forefront of our minds. We see beauty 24 hours a day, 7 days a week in social media posts and in television and print, and so it's something that our patients are thinking about. As Dr. Karani discussed, there's been a rise in non-invasive procedures. In 2018, there was $16.5 billion spent on cosmetic, surgical, and non-invasive procedures. Over 15.8 million non-invasive procedures were performed. There was a 3% growth year over year in the use of neurotoxin, with over 845% growth in the last 2 decades. If we compare that to our most common surgical procedure as oculoplastic surgeons, we've actually seen a decline in surgery with a loss of about a third in the last 2 decades. There's been a 30% growth in neuromodulators in the last 5 years, with the global Botox market collectively $4.5 billion in 2018, and we anticipate this to grow to $10.4 billion by 2025. So these 3 pictures were taken 2 seconds apart in my dark and dreary basement as I planned for this talk, but I think it highlights the effect that angles, filters, and techniques we can use to alter our photographs. In 2 seconds, I took myself from a 42-year-old female to a 20-something-year-old medical student with the click of a picture on my iPhone 7 touchscreen, and I totally altered the way I look. But this is really what our patients are doing, and it's no wonder that the biggest rise in non-invasive cosmetic procedures is in the millennial market. And I don't think it's a coincidence that the rise in social media and the rise in non-invasive procedures occurred simultaneously. So approximately 15% of those procedures that were performed on the millennial age group. And if you look at our Gen Xers and baby boomers, certainly they collectively make up the biggest majority of our injection patients. However, the fastest growing market is in the millennials. And a study performed by Allergan indicated that millennials are outspending their parents, their Gen Xer and boomer parents, by about $50 for products per year in terms of what they're receiving. And so it's important that we recognize that. And also, if you take a millennial patient and start injecting at the age of 25, they could have 50 years of receiving injections. So if you do 3 to 4 injections per year with an average cost of approximately $500, that's $80,000 to $100,000 in 2019 disposable income that those patients are spending on neurotoxin. And I think that's happened because in 2015, people didn't talk about what they were receiving. They hid the fact that they were receiving neurotoxin, but now people publish about it, and there's articles written about celebrities opening up about the use of anti-aging neurotoxin. And again, the rise really is attributed to the social media market. People like Kim Kardashian are receiving Botox on television. People are posting about who their injectors are and what products they use on their social media pages, and my friends are doing it too. And your friends are doing it as well. And so you should try and capitalize on that in terms of adding these procedures to your practice, because your friends are asking about it, your family members are asking about it. So I hope to give you some tools to try and open that up into your practice and armamentarium. If you haven't had an opportunity to read this book, I think it's fascinating. Dana Berkowitz really provides a sociological perspective of what America wrinkle-free looks like, and it really talks about the progression of anti-aging and the anti-aging market. And so I think it's a really great read, but it highlights targeting and the genius marketing strategies these companies have come up with to target the younger market. So there's 4 neurotoxins that are available and FDA approved for use to reduce wrinkles. Onabot, which is Botox, Incobot, which is Xeomin, Ababot, which is Dysport, and then the newest one, which is Praebot or Jeuveau. All 4 of these are commercially available for your use, and all really act and are different molecules. This is a table that summarizes it, and I won't belabor the fact that these products are different, but I want you to just recognize that they're all different. They all may have a different dilution, they all reconstitute slightly differently, and they all act slightly differently. So I think it's important to understand what you're injecting and tailor your injections towards your patient population. Suffices to say they kind of work similarly in their mechanism of action in that they cleave the SNAP25 protein on the acetylcholine receptor antibody, prohibiting the acetylcholine vesicle from binding and subsequently the acetylcholine release into the neuromuscular junction. So how can you get started? You know, I encourage colleagues to seek out courses outside of their home state or region. I think it's helpful to undergo instruction outside the pressure of your peers in your community. We have great courses here at the Academy meeting in the next several days, both instructional as well as skills transfer courses. I'd encourage you to seek out those courses if you're looking at adding this into your armamentarium. These are given by our world-class oculoplastic colleagues who perform injections all over the world, and I think it would be really helpful to seek these courses out. You can find them in your book. It's important to understand the underlying anatomy, and I think about this picture. This is the diagram I use in my office to document where I've distributed product, but I think about this picture when I look at patients, and so we'll go through that. This patient came in seeking neurotoxin to minimize the glabellarides, both in the procerus and corrugator, 11 lines in the horizontal rhytids of the procerus. And again, if you overlay that diagram I just showed you, you can illustrate on your diagram and plan out your injection pattern. Similarly, this patient was concerned about her horizontal rhytids of the forehead, and again, recognizing that frontalis is quite strong, planning out your injection pattern I think is helpful. This patient seeks treatment for the crow's feet or smile lines, and again, understanding that circular layer of orbicularis is right underneath the surface of the skin, resulting in those lines. So here are some basic injection patterns that I use in my office. This would be targeting the glabellar region. I tend to inject laterally, approximately 2 centimeters above the brow, to minimize that lateral brow flare if we're going to totally paralyze the glabellar region. Similarly, in this patient, seeking out softening of those 11 lines, and here for crow's feet. I have a couple of videos with audio.
Contractions of the brow protractors cause vertical and horizontal frown lines in the glabellar region. This can leave the patient with an angry appearance. Chemical denervation of the frown lines in this region has become widely popular. When treating the glabellar region, the patient is asked to mobilize their face to identify the strength and dynamic nature of the glabellar complex. Ice can be administered prior to injection for 30 seconds for topical.
Maybe it's buffering, I don't know. Looks like it.
Yeah.
They work next door.
Contractions of the brow protractors
Sorry
cause
about that.
vertical and horizontal frown lines in the glabellar region. This can leave the patient with an angry appearance. Chemical denervation of the frown lines in this region has become widely popular. When treating the glabellar region, the patient is asked to mobilize their face to identify the strength and dynamic nature of the glabellar complex. Ice can be administered prior to injection for 30 seconds for topical.
We could go on to the next one.
Transverse forehead lines often result as a compensatory mechanism to compromise for brow ptosis, dermatochalasis, and eyelid ptosis. Firing of the frontalis muscle results in horizontal rhytids in the forehead. At the lateral two-thirds of the brow, the frontalis muscle thins, leaving the tail of the brow unsupported in this region. This often leads to the temporal brow ptosis that occurs with aging. 5 to 8 injection sites are considered. Centrally, the injection may be a bit lower, but as the brow arches, care must be taken to stay at least 2 centimeters above the brow hairs to minimize the potential for post-injection brow ptosis. The skin is cleansed with isopropyl alcohol. Typical injection doses range from 2.5 to 5 units per site. The toxin is distributed 4 millimeters below the skin surface at the level of the frontalis muscle.
The essence of time, I may skip.
Care
just
must
to
be
the end of
in
this.
absence of a lateral injection.
Again, that lateral injection I perform just to minimize the lateral flare of the brow, especially if we're going to paralyze the corrugators at the same time in glabellar region. I will say that in this patient, I wish I would have shot the video a little differently now, but I tend to paralyze and treat higher in the forehead to minimize the risk that these patients develop lines just in front of their hairline. I think if we tend to weaken the central frontalis but don't weaken just in front of the hairline, they tend to have a rhytids right in the hairline that can be quite obvious. So how can you get started in your practice? Well, we've used both internal marketing as well as external marketing strategies. We have a newsletter that goes out to our patients as well as our referring providers every month. We shot a series of videos, including both our surgical procedures as well as non-invasive options that we provide in our practice. This picture looks like I'm about to sneeze, but this is an example of the video that we've posted online in terms of what we offer at our practice. We've also used external marketing strategies in terms of print, as well as our website to help us market non-invasive surgical options. And then I think it's important to point out the social media platforms because it will draw a different patient population than what you can achieve with external marketing and print magazine as well as commercials and television. And so it's also free, which is helpful. So in summary, spending on non-invasive procedures is on the rise. Our fastest growth is in our younger population. It's important to learn your available products, understand your clinical anatomy, take pre- and postoperative photographs, and then market to the patients you already serve. Thank you.
Thanks, Jill. That was great.